Yeah, because I move the arm. Can you see that in the video?
I can see you moving your arm, yes.
Can you see that?
Yes.
Oh, good. So then from there, press pause. Hi there, it's David here from My Sports Chiropractor. We often have patients who tell us that their shoulder clicks or clunks. So we thought the purpose of this video would be to explain what the clicking or clunking is, what the causes are, and what it is that we do to help get rid of it.
There are many causes of clunking in the shoulder, including overuse, previous trauma, and muscular imbalances. The most common that we see in the clinic are people who have unstable shoulders, and that includes bodybuilders, weightlifters, swimmers, tradies, and overhead throwers.
So what is the clunking and what's causing it? Clunking can come from a few different reasons, but one is bone hitting bone. Two would be the tendons in the shoulder, whether it's a bicep tendon or one of the rotator cuff tendons flicking over bone. And also it could be the cartilage within the shoulder is actually rubbing against the bone and it will make a clicking or clunking sound. In fact, Caitlin, our associate chiropractor, suffers from clicking and clunking in her shoulder regularly. So our goal in practice is to help manage that clicking and clunking. And we do that through several means. One is to improve the mobility of the shoulder by doing certain muscle releases of the front and back of the shoulder. We also incorporate some dry needles, some shockwave therapy, and some joint manipulations of the spine and the neck. The whole goal that we're trying to achieve is to improve your mobility, your shoulder stability, as well as the strength in the shoulder. We explain to many patients that if you're experiencing shoulder clunking and there is pain associated, then it's definitely worth getting looked at because it's telling you that something is pinching that shouldn't be. So if you are experiencing clicking or clunking in your shoulder, then give us a call on 0435 819 286 or book an appointment online with either myself or Caitlin and we can try and have a look and see what we can do to get rid of it for you. There are many causes.